health system is an organizational framework for the distribution or servicing of the healthcare needs of a given community. It is a fairly complex system of interrelated elements that contribute to the health of the people in their homes, educational institutions, in workplaces, the public, social and recreational, and the psychological environment. The health system in Kogi State is structured along the now universal 3 levels of primary, secondary, and tertiary levels. In Kogi State, the system is run concurrently so that all the 3 levels of government, local, state, and regional, even though they hold primary responsibilities for only 1 level each, they can exceed their areas of coverage and provide services at other levels. There is a global consensus that universal access to healthcare is an essential human right, which is critical to sustainable development. Nigeria is here to adopt innovative means to protect the poor and vulnerable populations against the financial risk of ill health. Given that a healthy people is a healthy nation, and considering the poor health infrastructure he inherited from previous administrations, Governor Yahaya Bello-led administration in Kogi State left no one in doubt about his commitment to reversing the trend. Kogi State government has fully renovated, remodeled about 239 primary healthcare centers across the world in 21 local government areas for proper usage and delivery of healthcare services to the locals. Kogi State has successfully completed a state-of-the-art nutrition house for acceleration nutrition results in Nigeria to quicken delivery of nutrition services to malnourished children in the state. Kogi State now boasts of a sustainable drug supply system, a mega drug distribution system which has eliminated the out-of-stock syndrome which existed in the past, an electronic data tracking system introduced to track drug consumption and utilization at health facilities across the state. The State Ministry of Health has a Public Health Emergency Operations Center specifically built and equipped for the coordination of emergency outbreaks across the state. Apart from the giant strides of Governor Yahaya Bello in the area of health infrastructure, in his quest to refocus and reform the health sector in Kogi State, he did not leave unattended to the issue of human resource motivation and welfare. Kogi State is one of the few states in the Federation that is implementing the 2014 revised CONMES. This is a salary package designed to address the issue of relativity for doctors working in the Kogi State health institutions. Today, no medical officer can leave Kogi State because of poor salary. The hyperbaric oxygen treatment unit has one of the largest and most advanced monoplace hyperbaric chamber system in the world. Through Kogi State, Nigeria is one of the few African countries to have this wonder of a medical equipment. Having this chamber in Nigeria through Kogi State will surely reduce medical tourism. There are instances where Nigerians are on the waiting list for 3 months before getting appointments abroad using this machine. Now, Kogi State has brought the chamber to Nigeria through Governor Yahaya Bello. The ambulance service unit is designed to provide advanced life support for all tertiary and secondary health service centers. The ambulances are equipped with patient multi-channel monitor, refrigerating system, world standard internal and external lighting system. The Governor Yahaya Bello-led administration has been able to create a robust and wholesome integrated health system whereby each of the 3 senatorial districts has a tertiary healthcare center servicing her people. This is indeed a revolution. The health reform of Governor Yahaya Bello in Kogi State is one of the best in Nigeria. To further achieve good quality health services as well as increase access to services at all levels, all primary healthcare centers are put under one roof. There is no doubt in the fact that no sector has received as much attention as the health sector since Governor Yahaya Bello came to power. Aside from the completed state-of-the-art medical diagnostics center in the state that is arguably the best in the country, other health programs have been going on, including the Healthcare Plus concept, which is an intervention mechanism introduced to help pregnant women and nursing mothers get on with life with less stress and more smile. With this scheme, child and maternal mortality, which was very high prior to 2016, has drastically reduced. Today, Kogi State can boast of a world-class reference hospital in Okene, an hospital that can rival any hospital anywhere in the world. This hospital is designed as part of the measures geared towards stopping medical tourism. According to PricewaterhouseCoopers, in their 2016 report, Nigeria spends over $1 billion annually on medical tourism, with 60% of it on 4 key special areas such as oncology, orthopedics, nephrology, and cardiology. And these are the areas the reference hospital will take care of. The reference hospital is an imposing 300-bed capacity hospital, a reference hospital for the treatment of advanced medical conditions that have been forcing Kogais and indeed Nigerians to go abroad. It has female wards, male wards, emergency wards, surgical wards, VIP wards, VVIP wards. It has a ward for renal ailments and another for dental issues. The hospital is fitted with ultrasound room for scanning, mammography, MRI machine, and hyperbaric oxygen center. It has a 60-seat capacity conference hall, standard seminar rooms with 6 projectors and electronic gadgets. Everywhere in this architectural masterpiece is electronically wired with CCTV cameras, automatic fire extinguisher, and water sprinklers. It has covered walkways because of rain and a robust panel for 24-hour water supply. The sort of massive investment in this hospital is the stuff only great men of vision and big dreams are capable of. With this immense structure, surely tourists will be attracted to Kogi State from far and wide. Kogi State has 838 functional primary health facilities, 54 secondary health facilities, 1,144 registered private health facilities. The state at the moment has 4,216 health workers, 2,012 registered nurses with commensurate medical officers and consultants. In 2016, when Governor Yahaya Bello took over the mantle of leadership, Kogi State had no dialysis center. But today, the zonal hospital in Ida has been upgraded into a specialist hospital to serve as one of the planned 5 renal dialysis centers across the state, situated in the Eastern Senatorial District of Kogi State. This hospital, amongst others, clearly shows the unwavering determination of Governor Yahaya Bello to change the narrative in the provision of quality healthcare services in Kogi State. Isanlu General Hospital is one of the leading hospitals in specialized medical services, advanced surgical intervention, data management, and ICT infrastructure. Incorporated in 2004 as a limited liability company, the hospital was conceived to fulfill a desire and close the yawning gap in the nation's healthcare delivery system. But over the years that degenerated and have become mere consulting room. Today, Governor Yahaya Bello has transformed the hospital into an ultra-modern hospital with all modern equipment ready to serve the people of Kogi West. In line with the campaign promise of His Excellency, Governor Yahaya Bello, an ultra-modern general hospital has been built and equipped in Gegu, designed to serve Gegu, Abaji, and environs. The Lokoja Specialist Hospital is a world-class hospital with a vision to maintain the highest standard of medical practice using state-of-the-art structure and equipment to meet the immediate and long-term health needs of the people. But before its remodeling, it was a sorry sight of degradation. It was an hospital with broken down walls, outdated equipment, and very low morale for staff. Look at how dirty and bad it was until Governor Yahaya Bello remodeled it into an hospital comparable to any in the world. Kogi State College of Nursing and Midwifery, or Bangide, is designed to educate and produce professional nurses and midwives that can raise the professional standard of nursing and midwifery, both in educational pursuits and quality care to the people. Thanks to His Excellency Governor Yahaya Bello, this school is one of the best in structure, in equipment, and service anywhere in the country.